Are you curious about the uses, benefits, and potential risks of duloxetine? In this comprehensive video, we delve into the common applications of duloxetine, exploring its wide range of uses and potential benefits. But before we jump into that, let's understand what duloxetine actually is. Duloxetine is a medication that belongs to a class of drugs called selective serotonin and norepinephrine reuptake inhibitors, SNRIs. It is commonly prescribed to treat a variety of conditions, such as depression, generalized anxiety disorder, diabetic peripheral neuropathy, fibromyalgia, chronic musculoskeletal pain, and more. Common applications of duloxetine. Duloxetine is widely used in the treatment of various mental health disorders and chronic pain conditions. One of the most common applications of duloxetine is in the treatment of depression. Depression is a mood disorder characterized by persistent feelings of sadness, hopelessness, and a loss of interest in daily activities. Duloxetine works by increasing the levels of serotonin and norepinephrine in the brain, which helps improve mood and reduce depressive symptoms. Another common application of duloxetine is in the treatment of Generalized Anxiety Disorder, GAD. GAD is a chronic condition characterized by excessive and uncontrollable worry about everyday life events. Duloxetine helps to reduce anxiety symptoms by altering the balance of certain chemicals in the brain. In addition to mental health disorders, duloxetine is also used to manage chronic pain conditions. One such condition is diabetic peripheral neuropathy, which is nerve damage caused by diabetes. Duloxetine helps to relieve the pain associated with diabetic neuropathy by blocking the reuptake of serotonin and norepinephrine, thereby increasing the availability of these neurotransmitters in the central nervous system. Fibromyalgia, a disorder characterized by widespread musculoskeletal pain and fatigue, is another condition that duloxetine is commonly prescribed for. The exact mechanism of how duloxetine works in fibromyalgia is not fully understood, but it is believed to be related to its effects on neurotransmitters involved in pain processing. Chronic musculoskeletal pain, such as osteoarthritis and chronic low back pain, is also a common application of duloxetine. By modulating the levels of serotonin and norepinephrine, duloxetine can help reduce pain and improve functioning in individuals with these conditions. Benefits of duloxetine. Duloxetine provides several benefits for individuals with the conditions it is prescribed for. One of the primary benefits of duloxetine is its effectiveness in relieving symptoms of depression. Studies have shown that duloxetine can significantly reduce depressive symptoms and improve overall mood in individuals with depression. For individuals with generalized anxiety disorder, duloxetine can help reduce excessive worry and anxiety. It has been found to be effective in reducing anxiety symptoms and improving quality of life in individuals with GAD. In the treatment of diabetic peripheral neuropathy, duloxetine has been shown to provide pain relief and improve overall functioning. It can help reduce the burning, tingling, and numbness associated with diabetic neuropathy, allowing individuals to better manage their condition. For individuals with fibromyalgia, duloxetine can help alleviate pain and improve physical functioning. It has been found to reduce pain intensity and improve quality of life in individuals with fibromyalgia. In chronic musculoskeletal pain conditions, such as osteoarthritis and chronic low back pain, duloxetine has been shown to provide pain relief and improve physical functioning. It can help individuals better manage their pain and engage in daily activities with greater ease. Overall, the benefits of duloxetine include improved mood in depression, reduced anxiety in generalized anxiety disorder, pain relief in diabetic peripheral neuropathy and chronic musculoskeletal pain conditions, and improved physical functioning in fibromyalgia. These benefits can significantly enhance the quality of life for individuals with these conditions. Potential side effects of duloxetine. Like any medication, duloxetine can cause potential side effects. It is important to be aware of these side effects and discuss them with your healthcare provider before starting duloxetine. Common side effects of duloxetine include nausea, dry mouth, constipation, dizziness, and fatigue. These side effects are usually mild and may improve over time as your body adjusts to the medication. If these side effects persist or become bothersome, it is recommended to consult your healthcare provider. In some cases, duloxetine may cause more serious side effects that require immediate medical attention. These may include allergic reactions, suicidal thoughts or behavior, increased blood pressure, liver problems, and serotonin syndrome. It is important to seek medical help if you experience any of these side effects while taking duloxetine. Recommended dosage of duloxetine. The recommended dosage of duloxetine varies depending on the condition being treated. For depression and generalized anxiety disorder, the usual starting dose is 20-30 mg once daily, which may be increased to 60 mg once daily based on individual response. For diabetic peripheral neuropathy, fibromyalgia, and chronic musculoskeletal pain, the recommended starting dose is 30 mg once daily, which may be increased to 60 mg once daily if needed. It is important to follow your healthcare provider's instructions regarding the dosage and duration of duloxetine treatment. Do not adjust the dosage or stop taking duloxetine without consulting your healthcare provider, as sudden discontinuation may cause withdrawal symptoms. Risks associated with duloxetine. While duloxetine can be an effective medication for the conditions it is prescribed for, it is important to be aware of the potential risks associated with its use. One of the main risks of duloxetine is the increased risk of suicidal thoughts or behavior, especially in children, adolescents, and young adults. It is important to closely monitor individuals taking duloxetine for any changes in mood or behavior and seek immediate medical attention if suicidal thoughts or behavior occur. Another potential risk of duloxetine is the increased risk of bleeding, especially in individuals taking blood thinners or nonsteroidal anti-inflammatory drugs, NSAIDs. It is important to inform your healthcare provider of all medications you are taking to avoid potential drug interactions and minimize the risk of bleeding. Duloxetine may also interact with other medications, such as monoamine oxidase inhibitors, MAOIs, serotonin-norepinephrine reuptake inhibitors, SNRIs, and certain antidepressants, increasing the risk of serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition characterized by high levels of serotonin in the brain. It is important to inform your healthcare provider of all medications you are taking to minimize the risk of serotonin syndrome. In individuals with liver problems, duloxetine should be used with caution, as it can affect liver function. Regular liver function tests may be recommended to monitor the safety of duloxetine use in these individuals. Precautions when taking duloxetine. When taking duloxetine, it is important to take certain precautions to ensure its safe and effective use. It is recommended to avoid alcohol while taking duloxetine, as it can increase the risk of liver problems and worsen certain side effects of the medication. Duloxetine may cause dizziness or drowsiness, especially when starting the medication or increasing the dosage. It is important to avoid activities that require mental alertness, such as driving or operating machinery, until you know how duloxetine affects you. If you are pregnant or planning to become pregnant, it is important to discuss the risks and benefits of duloxetine with your healthcare provider. Duloxetine may be used during pregnancy if the potential benefits outweigh the potential risks to the fetus. Breastfeeding while taking duloxetine is not recommended, as duloxetine may pass into breast milk and could harm the nursing infant. It is important to discuss alternative options with your healthcare provider if you are breastfeeding or planning to breastfeed. Alternative treatments to duloxetine. While duloxetine can be an effective medication for the conditions it is prescribed for, it may not be suitable for everyone or may cause intolerable side effects. In such cases, alternative treatments may be considered. For depression and generalized anxiety disorder, alternative treatments may include other classes of antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, or psychotherapy, such as cognitive behavioral therapy, CBT. These treatment options should be discussed with your healthcare provider to determine the most appropriate approach for your specific situation. For chronic pain conditions, alternative treatments may include physical therapy, acupuncture, mindfulness-based stress reduction, MBSR, or other medications specifically targeted for pain management. It is important to consult with your healthcare provider to explore these alternative options and determine the best treatment plan for your needs. Consultation with a healthcare professional before taking duloxetine. Before starting duloxetine or any other medication, it is important to consult with a healthcare professional. They will evaluate your medical history, assess your symptoms, and determine if duloxetine is the right medication for you. They will also provide guidance on the recommended dosage, potential side effects, and precautions to take while using duloxetine. It is important to be open and honest with your healthcare provider about your medical history, current medications, and any concerns or questions you may have. This will help ensure that duloxetine is prescribed and used safely and effectively. Conclusion: duloxetine is a medication commonly used to treat a variety of conditions, including depression, generalized anxiety disorder, diabetic peripheral neuropathy, fibromyalgia, and chronic musculoskeletal pain. Its ability to modulate neurotransmitters in the brain provides several benefits, including improved mood, reduced anxiety, and pain relief. However, it is important to be aware of the potential side effects and risks associated with duloxetine, as well as the recommended dosage and precautions to take. Consulting with a healthcare professional is essential before starting duloxetine or any other medication to ensure safe and effective use.